So this morning, I was presented with a relatively young 5-year-old male intact mixed breed named Bear. He presented with vague signs of anorexia, decreased activity, and apparent exercise intolerance according to his owners. Since he's an intact male, that might be a discussion we can have with his owners at a later time, but for now I think we should really focus in on the issue at hand. He is mostly an outdoor dog. His physical exam was largely unremarkable, with the blatant exception of a large abdominal mass. It was about 20 to 25 centimeters long as far as length and width goes. It was firm, and it was located in the cranial-ventral abdomen. It felt more prominent to me on the left side, and I couldn't see or find any evidence of lymphadenopathy or abdominal pain upon palpation. So, his history otherwise is unremarkable. He seems well cared for, very loved by his people. The owners first noticed the behavioral change about a week ago, and it seems to have gotten worse over the last 3 days. So the issue, at least the process, seems relatively acute to me. So right now, my master problem list going in is number 1, the abdominal mass, which is large and on the cranioventral abdomen. 2, exercise intolerance. 3, lethargy, and finally anorexia, which has been progressive over the past 3 to 7 days.
Okay, so what are you thinking at this point in time?
Well, right now I'm suspecting Bear doesn't feel great because he's carrying around this large mass in his abdomen, and that's probably producing most of his clinical signs, such as the lethargy, the anorexia, just not feeling great. Because of its location, I'm thinking the mass might be splenic in origin, and of course that makes me think about hemangiosarcoma, with all that implies. Bear seems a bit on the young side for that, but it's an important consideration because HSA is something you really don't want to miss. And I know HSA can also get quite large, so that would make sense with the clinical picture of the solitary mass cranioventrally. If it's a neoplasm, there are other possibilities as well. That could be arising from other organs around there, such as the liver, the stomach, the duodenum, or other intestinal loop that just happens to be up around there. And since he's young, I think a review of benign and non-neoplastic processes that could cause this lesion also seems appropriate.
So what do you suggest you recommend to the owner as far as a diagnostic plan?
Well, first, I really would like to do abdominal radiographs. That will really help us localize the lesion and perhaps figure out what organ this issue is arising from. And depending on what we find, an ultrasound might be a better option as far as an in-depth look at the tissue. As long as we're doing radiographs, I'd recommend a thoracic radiograph as well to check his lungs and make sure his chest is clear, because if we take a chest film and his lungs are full of mets, then that might turn into a quality of life conversation with the owners rather than proceeding with other invasive, difficult diagnostic procedures. So if the chest films are clean, which would be ideal, it would probably be a good idea to get a minimum database, so a CBC, chem panel, a urinalysis. I say that mostly because his signs are so vague. It would probably be a good idea to rule out systemic disease like renal disease or hepatic disease, especially since he's so young. I want to rule out the possibility of cancer if I can. I'm particularly interested in the CBC. White blood cell count would tell me if it's an infectious or inflammatory process, and the red blood cell count might tell me if he's anemic or not. And so that's been especially important considering that hemangiosarcomas and other splenic masses tend to be friable and bleed quite easily. Right now, Bear's mucous membranes are nice and pink, so there's no evidence of severe anemia, but it might be a more mild form that we could investigate. And depending on what we find on those results, we might move to an abdominal ultrasound to get a better idea of what's going on with the mass. So the radiographs will help us localize that really well, but the ultrasound will be what can tell us more about the tissue itself, and we can also investigate any metastases that might be spreading to other organs in that area. So that would be helpful. When we do ultrasound, we might consider doing a guided fine needle aspirate of the mass, or cytology, to see if we can aspirate cells from the mass, and so that could really tell us what's going on with that organ. Ultimately, it might come down to an abdominal exploratory or laparotomy, and that it's invasive, it's risky, and it's expensive, but it might be the only way for us to truly tell what's going on if all these other tests come back inconclusive, and it might help us decide if we need to remove the mass or something like that for there. So one thing I need to do personally is review the causes of splenic and cranioventral masses, including benign and non-neoplastic causes tonight. I think that would be a good review for us all, me at least, going forward.